Now, from CBS News Miami, this is Facing South Florida with Jim DeFede.
Welcome to this special edition of Facing South Florida. I'm Jim DeFede, and we are coming to you from the state capitol in Tallahassee, where hearings were held in both the House and the Senate this week to address the treatment of the mentally ill in the criminal justice system. But we also came here to follow Cindee Murphy, whose son Tristan killed himself at a state prison in Miami by taking a chainsaw to his throat. As we uncovered in our documentary, Warehoused, The Life and Death of Tristan Murphy, the state prison had failed to provide him the medication to control his schizophrenia and failed to give him the treatment and counseling he had requested. The documentary also pointed out the flaws in the competency restoration process, as Tristan, who was arrested and ultimately sent to prison on a littering charge, spent more than 400 days in an isolation cell in the Charlotte County Jail because the State Department of Children and Families didn't provide him the treatment that he was required by law to receive. Spurred in part by our documentary, the Senator, Jennifer Bradley, held an extraordinary hearing in the Criminal Justice Appropriations Committee, in which representatives of the Department of Corrections and the Department of Children and Families were called to testify.
Members, today we will delve into the intersection of mental health and the criminal justice system. We have three presenters with us today to shed light on different aspects of what is a very complex issue.
In addition to corrections and DCF, they also heard from Miami Judge Steve Leifman, who has been advocating for reform for more than a decade.
But this is not a DCF problem, it's not a Department of Corrections problem. And it's not a treatment problem, it's a system problem.
But the most powerful testimony came from Cindee Murphy, who never envisioned this would become her battle.
There's indication in the records that that everybody knew, all other inmates that were housed with him knew that he had mental health issues, that he was doing all kinds of bizarre things. There were some who stated, yeah, as soon as they handed him the chainsaw, I backed away, I didn't want to be near him, he's crazy. But this happened. And it happened due to the failures in the intake process, where he wasn't properly evaluated. He didn't receive his medication. He didn't receive any continuity in treatment or any treatment, period, for that period of time. And this is where people this is to me a critical issue. I think it resulted in part from staff shortages. Perhaps, I don't know. I mean, I'm not going to make excuses. I don't know why it happened. That's all still being investigated, but it shouldn't have happened.
During the hearing, there was a staggering realization of just how bad the problem remains today. DCF's Assistant Secretary, Erica Floyd Thomas, admitted that the agency routinely violates state law, which requires DCF begin treating individuals who have been arrested but found by a judge incompetent because of a mental illness. Under the law, they are supposed to begin receiving treatment within 15 days. But listen to what she told Senator Jason Pizzo under questioning.
How many patients right now have been waiting longer than 15 days in the state of Florida right now?
408. Oh, I'm sorry.
Yeah, you can go back and forth.
408. 15 days is rule, procedure, statute. What is it?
It's statute.
So 408 people right now are beyond what this legislature at some point has said is the maximum time to wait.
That is correct.
What's the longest waiting time for any of those 408 people right now?
Our average length of time before they were admitted to a facility is 56 days now.
What's the longest? Has anybody been there for 100 days, 400 days?
I think we had periods of time where it extended longer, specifically when we were doing the ramp back up after having all of our state hospitals closed, not doing admissions specifically after the pandemic. But since that time, once we've gotten staff aug and more beds online, that time has gone down. So I don't know specifically a key point of a length of time. I would say possibly we had more than 6 months before we were doing admissions. So.
Follow up. Who has been sitting waiting the longest of the 408 people? If you don't know, you don't know.
Oh, I do not know that answer to that.
Is it possible that someone's sitting there for 400 days?
Potentially.
That means right now there are more than 400 individuals sitting in county jails, just like Tristan did, who are not getting help. Now, after the hearing, several senators came down to hug Cindee. They also gathered around Judge Leifman to continue the conversation, as there does seem to be real interest in doing something to fix the problem.
If Tristan had been diverted before out of the court system and into mental health,
He never should have been arrested.
I know. But if he had been diverted and could have got qualified for Medicaid, we could have gotten the treatment that he needed.
1959. That's what most of the southern states are doing that don't want to expand Medicaid.
Yeah.
And you just ask for a waiver on mental health and the feds are giving it. And it's hundreds, maybe billions of dollars for Florida. It's a lot of money, but just promise me one thing. If you get it, don't put it in the existing system. You have to make system change so that the dollars are spent more effectively. And that's the key. If I had $1 billion and threw it into the existing system, nothing would change. Nothing. It's not just a money problem, it's a system problem. It needs more money, but you have to make some structural changes. These warm handoffs, these system changes, they're not complicated. You know, I have a staff, they do it, we get money from the feds, the state, my local government, my managing entity, you figure it out.
Well, we don't need to wonder whether it works.
Right,
We know it works.
works.
We know it works.
Right. The system's so bad, it's beaten, you're filming, so I shouldn't say it's beating the crap out of them, but it's beating the crap out of them. They don't care anymore. And so by the time they get arrested, they've given up. And so, and it's not always they don't want to take medication. Sometimes they lack insight to their illness, but most of the time they don't care if they breathe. And so we have peers. We, at our height, had 8 peers working for the court. 4 of them graduated from our program. And they help these folks reestablish relationships. Senator Roussam passed a great bill last year for us. And they reestablish relationship. It incentivizes them to want to get better. And they start to build their lives back. But it's slow, it's not overnight, but it works.
We will hear more from Tristan Murphy on what these few days were like for her later in the show. But I spoke to several key Republican senators who are on the committee. Here is Senator Jonathan Martin, who is also the chair of the Criminal Justice Committee and is known as a strict law and order legislator. But even he was moved. Do you agree that now is the time that we finally reached a point where there needs to be some reform, some change as it relates to the intersection of mental health and criminal justice?
I think we reached that time a long time ago. I think that, as the judge mentioned earlier, with term limits, it's hard to find enough continuity with the solutions and getting the solutions across the finish line. These are very complicated issues that don't just involve drafting statutes, but also making sure the statutes comply with our Constitution, which defaults to individuals having liberty as opposed to being locked up because a government official wants them locked up. So those are all very complicated issues, and it takes a lot to get to the point where you have a law that deals with the mental health crisis, but also protects individual liberties. And from the group of people that are on this committee and appropriations for criminal justice, but also the Criminal Justice Committee as well in the Senate, there's a large desire to tackle these issues, and it was really refreshing to hear about the successes in Miami-Dade with the bold steps that they took to deal with this issue. And look, even on the fiscal savings, it's important because that's sometimes what can get a big idea across the finish line.
Here's the chair of the Appropriations Committee, Senator Jennifer Bradley.
Jim, I mean, this meeting could have been 3 hours. I mean, we could have done 2 meetings on this. This meeting was just enough to scratch the surface to let us know how much more we need to uncover and work on this issue. We heard from DOC. We heard about competency restoration. We heard from Judge Leifman, who has incredible experience in the state trying to divert people with mental illness from the criminal justice system. But we heard from Cindee, from Tristan Murphy, who was, you can hear the stats, you can know about the problem, but when you hear Tristan Murphy's testimony and you hear the story of Tristan, it's compelling, and it puts a face on a problem that just seems vast and unfixable. and I think people need to see that there are real families affected, that there are real lives taken, and we have a role. That's our role, is to fix that and to bring together the experts like Judge Leifman, who is doing that, who is exploring opportunities and innovation and programs and thinking outside the box and getting best practices from other states. That's our job. And I think you'll see some bills this session. Senator Martin has a bill, the House has a bill, the Senate are running a bill on Baker and Marchman. Is there so much more we could do? Absolutely, and we're going to continue to explore all of that.
It almost feels as if this is such a massive problem that it almost becomes intimidating to try to tackle anything. But you have to start somewhere.
You have to start somewhere, and you have to take it piece by piece. Is it all of DOC, or are there issues at DOC? Absolutely. Is DOC equipped to handle acute psychotic inmates in their system? No, they're not. DCF, the courts, can they handle this? We have got to tackle it systemically, and not look for a silver bullet. There is no one silver bullet.
It seemed to me, listening to DOC and DCF, and they testified as to the way the system is designed to work, sounds good in theory, but I don't know that in practice some of the things that they testified to is in reality. For instance, after somebody's restored to competency, that there is follow-up and aftercare. That's never been my experience in seeing that.
I think some of that is aspirational. When people return from having their competency restored and their charges are dropped, from my conversations, there's not a lot of continuation of services, and these people have just now been through an incredible ordeal, and they have no services, and they're no better to a real treatment plan and being able to reintegrate into the community than they were before it started, before the state spent untold dollars and took this person's liberty for untold days, and we can do better.
There does seem to be an interesting moment here, and I don't know if I'm reading more into it, but it seems as if the governor is talking about mental health reform. The House Speaker, said that reforming Baker was one of his top priorities. I know Senator Pasadomo has made health care, including mental health care, a critical priority for her this year. Are we seeing sort of a confluence of events where we're seeing votes in committees 18-0, in terms of Democrats and Republicans coming together? Do you think this has finally gotten past that partisan?
The depth of the mental health crisis is unavoidable. It's unmistakable, from schools to what's in our prisons, to what we see in crime. And it is incredibly expensive. And I think you just realize you reach that point where we have been banging our head against the wall, not getting results, and more money after bad is not helping. And there is an appetite. I think there is an appetite to try to look for solutions and finance additional solutions and think outside the box. And I look forward to, I'm hoping that the follow-through with those initial statements is there, because it's incredibly important.
If I had asked you a year ago if you were optimistic about changes in mental health compared to today, are you more optimistic today than you were a year or two ago?
I'm more optimistic that people are willing to consider alternatives. I think a year ago people would have been willing to just put more money in the same programs that aren't working.
When we come back, we follow Cindee as she meets legislators in the House, including the next speaker, Miami Republican Representative Danny Perez.
I'm Danny.
Hi, Danny. I'm Cindee Murphy. It's nice to meet you too. Thank you. It's good to have a little bit of time to talk to you. So.
My pleasure.
Stay with us. Welcome back. For the first time, the Florida legislature seems ready to deal with the crisis of how to treat the mentally ill who end up in the criminal justice system. And helping drive that push for change is Cindee Murphy, whose son Tristan killed himself with a chainsaw in a state prison after being sent there on a littering charge. We told his story in our documentary Warehouse, The Life and Death of Tristan Murphy, which showed how jails and prisons offer no real treatment and simply place those with mental illnesses in a box to be forgotten. During her trip to Tallahassee, she met senators and representatives from both parties, including the incoming House Speaker, Miami Representative Danny Perez.
Well, I'm here because I want to make sure that it doesn't happen to anybody else. So whatever I can do to get the word out, to make people more aware of what's going on in our criminal justice system, and spark some change. That's why I'm here.
And I'm glad you're here, for the mission that you're on, a worthwhile cause. But for the mission you're on, this is the building to do it. This is, as we all like to say, this is the people's house.
Mm-hmm.
So whatever I can do to help get your message out to other representatives, other colleagues of mine, you let me know. This is not an issue of Republicans or Democrats. This is an issue that both sides of the aisle will agree upon.
Mm-hmm.
Mental health is important. I'm sure you hear this all the time, but man, God bless you, and whatever I can do to help you.
Just keep this at the forefront of legislation.
Make
Make it a priority. No, it shouldn't. And having gone through this from for the period of time that we went through it, and from the county jail level, and dealing with the local prosecutors and the defense attorneys, and then into the DOC. I mean, there's so many stages along the way that errors were made, or that he could have been diverted in different ways that would have had a totally different outcome for him. And so it's not just there at that facility. I mean, they're the ones who handed in the chainsaw, and that was so wrong. And things that happened there were so wrong. But the whole system is so broken. And I know that you're aware of that. But when the whole criminal justice system has become our mental health system, it doesn't work, and it needs to change.
One of the reforms being pushed this year are changes to the Baker Act, which allows a person in danger of harming themselves or others to be committed to a treatment facility for 72 hours. But there is no real follow-up once a person is quote-unquote stabilized and they are released. State Representative Pat Maney is a Republican from the Panhandle. A former brigadier general, he became a judge where he saw the issue of mental health up close in his courtroom. That spurred him to run for the legislature, as he told a House committee this week, looking to reform the Baker Act.
When I had a previous job, I got really frustrated in dealing with Baker Act cases because it frequently seemed like there was no good solution. The law just didn't work. And many times I said to myself and out loud, what were they thinking? In 2020, I decided to become one of those people that somebody else can say, what were they thinking?
After the hearing, I sat down with him in his office.
Over time, I started getting involved in how much is this costing us? I mean, we're picking up the same people 3 and 4 times a year. And in the smaller communities, law enforcement, the providers, and the judge pretty much knows which bodies, which people have mental illness. And so then I started thinking, why are we picking them up so often? Why can't we treat them and get them well as opposed to treating them, getting them stabilized?
Do you think that there's a greater understanding that this is a problem that needs to be addressed?
I mean, I'm very excited that the Sheriff's Association, the Police Chiefs Association, those kinds of groups do come forward. But the public at large, even those people who have family members, loved ones, friends who are going through it, they don't really talk about it.
There's still the stigma.
There's still a stigma associated with it.
Now, let me ask you about the committee bill that's being put forward. It's not everything that you've had in your previous bills. It goes a little short of that, but you still think it's a good bill and it's a good starting point. And my understanding is, from talking to a number of people, there's the hope to still improve the bill in certain measures, correct?
My goal is to get a good bill passed that'll make a positive difference. I don't want the perfect to be the enemy of the good. I do think we can make improvements. I think there's a sense that improvements would be helpful. I think it's lost in the details of how many additional improvements we can make. But one thing I would really like to make is to broaden the criteria.
Allow more people to potentially be brought into the Baker Act system so that they can get the help they need.
At least brought into the mental health system. I'd like to see a pre-crisis capability. I'd like to see a warm handoff and post-crisis capability. The pre-crisis would keep people from going to the state hospital, a diversion program, if you will. The post-crisis would work to stop recidivism and having people coming back in.
Because that's really...
So the people who really need longer-term care are getting longer-term care. Right now there's a shortage of beds, so the goal is to get people stabilized and get them out. Well, to get out and don't take their meds, they're going to come right back. But liberty's important, and to me it's a liberty issue to keep taking somebody off the street or out of their homes and put him in let's put them in long enough to get them well.
Did you take solace in the notion that it was an 18-0 vote, Democrats and Republicans jointly? This is not a partisan issue, is it?
It is not, as far as I'm concerned. In fact, 2 years ago, I got the bill through 3 subcommittees and committees. And in getting through 3 committees or subcommittees, I never had a negative vote. The problem is there's just not a broad enough knowledge of the problem and the hope, the feasibility of improving the current system.
By the end of the week, Cindee Murphy was clearly exhausted, but she felt good about her trip. What have the last couple of days been like for you?
Yeah, I never thought I would have to do this. But yeah, it's been interesting up here to see how Tallahassee works, for one thing. And I've been happy about the reception that I've got from people. There have been so many important people willing to spend some time talking to me about these mental health Can I just start?
Yes.
Okay.
It's okay. Let me start over.
Okay.
You never envisioned being up here, having to do something like this. What have these last couple of days been like for you?
Well, you're right. I never thought I'd have to do something like this, but I'm glad to have the opportunity to be here. I'm thankful that so many people have been willing to talk to me about what happened to Tristin and mental health issues. I kind of have, in leaving, I kind of have these mixed feelings. I feel like there's a lot of interest among the legislatures in both the House and the Senate, but I keep also constantly being warned that things don't happen quickly up here, that changes are going to be hard to achieve.
You've held it together amazingly well. There were times where I can see, because I know you well enough, you've wanted to break down. How have you kept it together?
Well, oh gosh, it hasn't been easy. You know, I've been living with this for the last 2 years, and you get to the point where it's like, yeah, I can talk about this finally without breaking down. It's taken a long time to get to this point where I even could say anything about his death. But now I think I've gone through a different stage of grief, where I've gone from sort of being buried in grief to just being angry and wanting to make sure that changes happen. So
you don't want to have this happen. That's been the message. You don't want to see another mother go through this
not at
ever
all.
Again.
No, never, ever, ever. Things that happened to Tristin shouldn't have happened. They were preventable. And yeah, I know it's going to take time for change, but if it keeps getting chipped away at bit by bit, then maybe things will be better in the future for other inmates.
This isn't probably going to be your only trip to Tallahassee, right?
I've been told that several times. And I'm willing to come back. I mean, whatever it takes. My voice is not going to be silenced. There needs to be changed. And I've been told several times today by different legislators that my voice is powerful as a parent who's been through it, and that this is what creates change.
You put a human face to it. It's not an abstract concept when they look into your eyes.
Yeah, so if that's the role I need to play, then that's what I'm going to do.
But it's a hard one.
It is a hard one. Yep, definitely.
Who do you do it for?
I'm two parties, really. I don't want any other parent, I don't want any other inmate to go through what Tristin went through. You have a tear in your eye. But I do it for Cody and Colton too. I want them to know that this shouldn't have happened to their dad, that there were mistakes that were made, and that we're doing everything we can to fix it. It's too bad, too late to bring their dad back, but maybe we can make sure that his death meant something.
Okay. Thank you. Thank you. You did great. You did great.
Oh, I can breathe.
We'll be right back. We will continue to follow what happens and whether the needed changes are enacted. Thanks again for watching, and enjoy the rest of your day.